Hello, my name is Lindsay Bauer, and this is my colostomy care video. So I'm going to start off by entering the room, introducing myself. Hi, my name is Lindsay Bauer. I'm going to be your student nurse today. Do you mind if we change your colostomy bag? Perfect. Awesome. Can I get your first and last name and your date of birth? Perfect. I'm going to close the curtain for privacy, and I'm going to perform hand hygiene. I'm going to approach the patient, get them in a comfortable position. I'm going to put on my gloves. Alright, I'm going to start by removing the old colostomy bag. Perfect. And at this point, I'd also remove the wafer here. But due to limited supplies, I'm going to be leaving that there. But if I were to remove it, I would hold the skin tight and I would slowly peel away the wafer to prevent any tearing of the skin. Sometimes people will use like an alcohol swab or something just to help get that stickiness to go away. But I would take this to the bathroom and I would empty it, measure, and then I'd discard my ostomy bag. I would then come back to my patient. I would, at this point, I would remove my gloves and put on clean ones, but for the sake of supplies, I'm going to be leaving these on. So remove, apply clean ones. Next, I'm going to use the approved solution, and then remember, without the wafer, we're going to be cleaning around the stoma. We are going to be observing the stoma, making sure it's not black, necrotic, nice and pink, like this one is here. Then I'm going to add a like a barrier prep to the stoma, or around the skin on the stoma, like so. And this will prevent irritation and leakage of the stool. So next, when I apply my wafer, I would open it up. I would then measure my stoma and I would cut around the wafer. So I would use my scissors and cut the appropriate size. Perfect. Then I would remove the tape on the inner ring. I would apply it, making sure sizing is still good. Perfect. And then I would then remove the outer layer to remove the stickiness, and I would attach that to the rest of the skin. Lastly, I would take my new bag. I would attach to the new wafer ring, just as so. I would make sure we are rolled up, not gonna leak. And I'm just observing to make sure everything looks correctly. I'm gonna check all around to make sure we aren't gonna have any leaks. Perfect. Lastly, I'm going to remove my used supplies, discard. I'm going to remove my gloves, perform hand hygiene. I'm going to make sure the patient is in a comfortable position, and then I'm going to chart, and then I'm going to leave the room. Thank you.